Okay, I think we're set. It is top of the hour.
Yeah, let's get started.
All right. Well, thank you guys all for being here, spending some time with us this morning. This webinar today will provide you a 1 CE credit. Please stay to the duration of this presentation and enter in your license number so that you can receive credit. But to kick things off, we might have some agents on the call that are not members of NABIP. So what is NABIP? NABIP is an acronym that stands for the National Association of Benefits and Insurance Professionals. We are the leading organization for health insurance and employee benefit professionals. NABIP represents more than 100,000 licensed health insurance agents, brokers, general agents, agencies, consultants, and benefit professionals through more than 200 chapters across America. Collectively, we work to ensure all Americans have access to high quality, affordable healthcare and related benefits. We advocate for affordable, responsible health insurance market solutions to secure the future and stability of our industry. In next week, we have a host of your NABIP state chapter and local chapters going to Capitol Hill to meet with your legislators, your senators, for one voice. If you are not a member of NABIP, join now so that your voice is heard. But to kick us off today and talk about growth strategies, level funding health plans, we have Chris Calderon here. Let me tell you a little bit about Chris. Chris is the Chief Revenue Officer at Difference Card. He started his insurance business in the insurance business a little differently than most people. The head of maintenance at school, he worked in his family friends with the Aetna sales director. At Aetna, that Aetna contract was married to my third grade teacher, and he had gone to some university. He went to the university, he had a few connections. He enrolled in Aetna Group School to learn the insurance business. And from there, it just blossomed. He was drawn to the Difference Card because after working for Aetna and Anthem Blue Cross Blue Shield, he saw firsthand the excessive margins on the insurance carrier side. With that, Chris, I'm going to turn it over to you so you can tell us about the growth strategies using the Difference Card. Thanks for being here today.
Hey, Shauna, thanks for that introduction. Appreciate you all joining us today for this CE credit class. And hopefully you all get something out of it. We're going to talk about some strategies to help you all differentiate yourself in the market. So we'll start with growth strategies, talk generally about the different alternative funding vehicles in the space. And then you're not just going to hear from me today. You're going to hear from some other really knowledgeable colleagues throughout the industry. So I'm going to let them introduce themselves, and then we'll get into the presentation. But Brad, why don't you kick it off first? Brad, just take yourself off mute, and then we're good to go.
First technical difficulty out of the gate. Hi, everyone. Sorry about that. Yeah, it's the first time I've done this. No, Brad Hamsher, I'm a principal and the lead consultant at Sankaty. We focus on really one specific niche market, which is executive health programs. So I'm happy to be here, happy to convey a little information and history about these types of programs, and we'll also be around to field any questions you guys have at the end of the presentation. So
thanks, Brad. And Richard, why don't you take a minute, introduce yourself?
Yeah, absolutely. Thanks, Chris. Appreciate everyone joining the call today. I have the privilege of being the president of Edison Health Solutions. We're a third-party administrator based in Tulsa, Oklahoma. I've been with the company now for over 7 years, and we have the privilege of serving members every day through some of life's most challenging opportunities where we deal with their health and their finances. And so that's the role I play here at Edison. And again, thank you all for joining today.
Thanks, Rich. And last but not least, Josh.
Hi, good morning, everybody. Josh Pyzik, Director of Sales at the Difference Card for our Midwest and West markets. Worked with Chris for the last 13 years at the Difference Card, and I'm going to be talking mainly about the medical expense reimbursement plan that we specialize in here. So welcome and happy to be here this morning.
Thanks, Josh. So I'm going to kick it off with growth strategies, and then I'm going to let the experts actually talk to you about how those strategies work in the market and how to use them for the right customer at the right time. But what we'll start with is why you should care about these growth strategies. And what we found is there's a lot of competition in this space. The small to mid-size marketplace is very crowded. There's a lot of agencies, and it can be difficult to find the right solution for your agency that differentiates your value prop in that segment to try to win the business if you're trying to grow your business and win new customers. So what we're going to focus on today are unique funding solutions that can help you provide better benefits at a better price and ultimately help you to grow your business. And you get some CE credits along with it. So again, just to start with the problem that we see, relationship-based selling can be a great way in the door, but it may not be the final wedge to actually get a change in broker of record or a change in the deal. You need something that actually has some teeth to it to actually move the needle for your customer and get you over the finish line. A lot of the basic services and value prop that we hear from a lot of different producers out there are great, amazing services, but it's not that different from the competition. So you need to find something different to set yourself apart, especially if you're in the small group space, right? We know that under 50 life marketplace where the rates are the rates and you can't negotiate with the carriers, you need to find something different to help your customer get through that health insurance hurdle. So what's a business owner to do? We're going to talk about some of the potential solutions, but before we get into the solutions, we want to hear from all of you. We're going to ask you all 3 questions throughout this presentation to 1, make sure you get credits for being here, and 2, we'll learn a little bit about you all as well. So I'm going to launch the first poll question, and that is, which strategy have you used successfully to win new business and grow your business? So some of the options are using the traditional approach, fully insured carrier, and just making plan changes, turning to level funded health insurance, using executive health plans, using the MERP funded strategy, or going to that extreme of going self-funded completely. Which strategy has worked best for you? All right, we've got about 80% of the team here answering. I'll give a few more seconds. Get your answers in. Remember, you do need to answer all the poll questions to get the CE credits. Going once, going twice. I'm going to end the poll and I'll share the results with everyone. So it's a pretty close call here between level funded health plans and just the basic kind of fully insured approach, making plan changes. So Richard, when we get to your part, I think you're going to be the most popular here. People know the level funded strategy you're going to talk about, but also a pretty good chunk of self-funded knowledge too. 10 folks have done self-funding. And then hopefully you all learn something when we get to the executive health plan piece of this and the MERP funding strategy, because it seems like there's the most need on that end. All right, so why don't we stop the poll here and we'll keep moving. So just a little bit more about the why you should care about this topic. The results that we've seen over the past 12 months are pretty outstanding. Using these types of alternative funding approaches, we've seen brokers win over 160 million of new premium just in the past 12 months. That's from almost 200 new BOR wins using these types of strategies. And that equates to over $8 million of new commission revenue for the producers that we partner with. So some pretty great results. So why don't we start by just talking about the general health insurance financial funding spectrum. There are a lot of different options out there, and it is amazing because the majority of the market is still fully insured, especially in the small to mid-sized space. Over 60% of the market is still in a fully insured plan, and they're still buying a gold level benefit. So there's a lot of room to help these organizations think outside of the box, find a different strategy and solution to save money and potentially provide a better benefit as well. So on the left side here, the fully insured, lowest risk, but highest premium, highest margin to the carrier. You're not going to save much money just doing the traditional fully insured approach. The next level up is executive funding. And this is really an interesting tax play for executives, for owners, can improve the benefits. It's also got a pretty low risk and moderate fixed premium. Brad's going to really talk about the details of the executive funding approach. Next down the line is level funding. Now, level funding often looks and feels like fully insured, right? You're not taking on too much risk because you're paying at the attachment point, the aggregate limit. So it's moderate risk, moderate fixed premium, and pretty good potential for savings there. You're going to get some surplus back at the end of the year if you run better. Often you can get some better rates using level funding. And I'll let Rich really talk you through all the benefits of the level funded approach. Josh is going to talk about the MERP funding strategy, and MERP funding can sit on top of either level funding or fully insured. That's why we've got it as that next step in the spectrum here. It's got a lower fixed premium. It's got some moderate risk. There are some protections in place to make sure the customer's not taking on too much risk, and it's got very high savings potential because you can combine the power of level funding and MERP together to really come up with a great approach. And then finally, that last step, self-funding, which Rich, your organization knows a lot about too. We're not going to talk about that today. That would take a whole nother hour. A little bit more risk. You're buying stop loss, hopefully to protect yourself, but really low fixed premium and has the best potential for savings if you're going that self-funded route. So these are just some of the options in the health insurance savings funding spectrum. And today we're going to focus on executive funding, level funding, and MERP funding. So I'm going to turn it over to Rich Hardin. He's going to take you through level funding plans with Edison. Go ahead, Rich.
Perfect. Thank you, Chris. Thank you again for the opportunity to share a little bit about the knowledge that we have on the level funding side, but also some solutions that we offer here. To talk through the key benefits of level funding plans, we really view them as the advantages for the plans. Is the first is predictable monthly cost. That's been one of the biggest pillars when people are moving from a self-funding plan to the level funding plan, is that it keeps the fluctuation to a minimum and it keeps it consistent for them each month. And that allows them to accurately budget for the expenses month to month. Then looking at potential refunds. In a fully insured arrangement, you don't get a refund back. Any excess funds or any excess amount left in the claims fund, Blue Cross or Aetna or United, they're going to put that money in their pocket and they're going to keep it. And then occasionally they'll give you an increase on top of that. In this model, whatever funds are left available in the claims fund at the end of the stop loss contract period, we do a year-end review, and then any funds left over does go back to the employer in the health plan. And then retaining the unused funds, that's again continuing that same portion. It allows them to then use that money we've had some employers look at, we've had an extra $50,000 come back this year. We're going to buy everyone Apple Watches or Fitbits. We're going to enroll in a fitness program or a wellness program. We're going to have other creative strategies on how to use the money. Or they look at doing premium holidays and saying, we're going to give everyone a month free, or we're going to reduce the premium by 10% this year for everyone, just to be creative with that unused funds. Or I have groups that will roll the money over and they just want to keep the money into a fund and let that fund grow over the next couple of years to see if they can then do something even bigger for the population. But we really view this as a fully insured takeover. So when you're looking at the plans, they want to make the right steps to self-funding eventually. They're nervous about making those steps. Going level funding is a great step to go from the fully insured, take the next step and going into level funding, because you have a lot of similarities to fully insured, but it is a good next step to kind of test the waters and see how it feels going into a different type of plan. And it also helps ease the pain for any type of disruption for members. So the impact on premium and savings, one is that we look at different lower premiums. We have the refund opportunities and long-term savings. A lot of what we have found with the level funding carriers, and especially in the stop loss market, is that we've got stop loss partners today that have been very creative and they've moved into this space and being unique. One of the challenges years ago when we were trying to do level funding administration, we ran into stop loss partners that weren't very creative on the risk taking. So they didn't understand that we need to cover the PBM fees under the claims, and we didn't understand the case management fees or the utilization management fees were all separate line items because they were trying to pull from a self-funded world and make it fit level funding. And in a level funding plan, where carriers have gotten really creative is that they've lowered the barrier for the stop loss premium, and they've put more into the funding side that allows a little bit more creativity. Or we see the reverse effect where they're changing the bucket and where they're putting the money, which that allows is because of the reimbursement models with the aggregate accommodation and other protections, it impacts the premiums and the savings. So it does bring in additional long-term value there. We've also seen partners in different markets with different niches go into a model where they put a captive around the plan and they go with a level funded option and still do that even in a smaller market setting. So again, hitting on a few key features again, the fixed monthly contributions to where an employer is going to get one invoice a month. They're not going to get 5 or 6 asking for weekly funding, asking for a different cost. Your fixed monthly contributions and your claims contributions are all going to be in one invoice. The claims coverage, so that essentially anything that covers in the plan would be responsible for is going to be covered in that claims cost. If we're out of the gate and we've got a smaller group, like a 20 life group, and we've been hit immediately in the first month of the plan year with a $30,000 claim, and we've only collected, let's say, $10,000 for claims coverage, out of the gate immediately we're going to have stop loss funding there where we're going to do quarterly true ups with stop loss to ensure that they're made whole. But out of the gate, if we have a 1 month we're $20,000 above and we don't have the money to pay the claims, stop loss is immediately stepping in to cover that. So that helps with the claims coverage of any unpredictable cost, but also giving that employer the feel of a fully insured look and feel of the product. And then also from the administrative costs, that's where a company like Edison, we step in to ensure we help within that different piece. And then there's a portion of the funds that go into the claims reserve that allows that money to grow throughout the year to cover any fluctuations. So potential risk and financial protections for the plan. So level funded plans do provide a predictable cost structure, but there are some potential risk. So in that model, even though they're moving to a level funded plan, they are still offering their own health plan. So the step that they move towards a fully insured world is that on the Blue Cross model or United or Cigna or Aetna, they are the plan that's offered. They are the fully insured carrier. In a level funded plan, the fiduciary liability does go to the employer, to the health plan at that point. So it is an additional step that goes into where they are taking on that extra layer of risk. So the most important part from my perspective, if I was in your shoes as an advisor, I'm looking for what's the stop loss protection, what are the risks around it, how do you handle claims that might fall outside of stop loss, and looking for any gaps to where that plan is not covered. Also ensuring that you have an administrator that has experience in a level funded health plan. You can't just move from doing self-funded to level funded if you've never done it or have that experience. It is an administration process, technique, and what's required from a TPA's perspective. And then you've got the risk of the high claims that do come in. You do have situations where members are a claim is delayed in submission from the hospital. Now we've got a balance bill risk to where the provider didn't submit it within time. You've got timely filing. You've got other things around it that can cause issues for that process. So ensuring that you have proper plan document language, ensuring that there's right documentation and processes around high dollar claims when they're received, the audit protocols and other things to protect the plan. So those are other pieces around that. When you're looking for a good partner in this, are just some things to consider. And then mitigating financial risk. One of the the great values of going to a level funded plan versus being fully insured is that you're able to put in different plan offerings to help control costs and to be able to provide more options for the members, like, for example, free benefits and other things that are creative there. One of the great advantages of the new world we're in is artificial intelligence. And before, it was a very cumbersome process to quote level funded groups. And in the new world we're working in today, we're able to get quotes out the door in 24 hours. We do not need claims data or history. If you have it, we will take it. But the great world we're working in now is that we can turn proposals around within 24 hours with a member, employee, and dependent level census. We just need 5 basic information on that census, and we're able to get a quote back out the door. And what we're looking at are credit card swipes and other, how they spend their money, what their search history looks like. We're looking at other demographics that are made publicly available and using that to help predict a risk score. So in that, the great advantage is that we're able to get quotes back out the door within 24 hours, and they're extremely effective. So. This is a quick case study. I have a group that was based actually here in Oklahoma. We took them level funded back in 2018, and this gives you a trend of what it looks like over the years. And with the broker we work with, we're always balancing their plan against fully insured each year to do a market check to see how the plan's running. And this gives you an example. Look, over a 5-year plan, we ended up saving their plan almost over $450,000 in that 5-year time frame. And from that, that's in conjunction with the money that's left over in the claims fund. So given an example of a group that's got 50 lives, I mean, they're able to use that money and be creative with their plan, do premium holidays, as I alluded to earlier in the conversation. So one of the things at Edison that's unique to what we do, and this is where we get into the appropriateness epidemic, and we get into different programs you can put around it. Edison was started from the mindset of well, our program was started from Tom Emmerich, who was the founder of Edison, but he was the head of benefits of Walmart. And what Tom discovered in his days at Walmart, that the problem that they were facing there was that it wasn't exactly price across the country. The problem is they were paying for things that people did not need. And so what he developed at Walmart was a program to help cut the cost of care, to help make sure that the diagnosis and treatment type was correct for patients. And what he found is that the misdiagnosis epidemic that was happening. So he built direct contracts with hospitals across the country and transitioned Walmart patients there. When Tom retired, employers were calling him saying, "Hey, come build the same thing for us." And Tom didn't want to just make this program available for just another employer. He wanted to make it available for many. And that's where Edison was birthed, is to be able to bring the value and the negotiating capabilities of Walmart, but make it available for the everyday employer. And that's where we got our start. About 4 years ago, we purchased a TPA to bring into this story of the misdiagnosis epidemic in Edison Healthcare. And bringing in the TPA arm is being able to build a health plan the right way around cost and quality to ensure that patients get the best success. And so what you're looking at here today is what we show are the misdiagnosis percentages that are occurring with each diagnosis vertical. So cancer, 35% of cancer cases in Edison are misdiagnosed. You're looking there at joint replacements at 64% are misdiagnosed. Spine at 78%, which is a very high number. And then you go into like women's health and then transplants there. Women's health at 40% and transplants at 33%. But you look at there at cancer as an example. 1 out of 3 cancer patients are misdiagnosed. So that may be wrong staging, wrong type of cancer, or we found patients stage 4 cancer, less than 6 months to live. Patient never even had cancer. They have an infection that was left untreated. We went in and treated the infection, and the patient's alive and well today. This is the heart of who we are. This is the heart of what we're doing. And the great thing is you can offer a benefit like this in a level funded plan, and a patient can go to Mayo Clinic for free. That's an incredible value for them, and it gives them the opportunity to encounter healthcare in a new light. That's really the advantages of putting where you're stepping into from a fully insured world. You're not getting that free benefit to a level funded plan. You're tasting the advantages of a full self-funded plan, but you're still getting the financial protections and look and feel of the fully insured world. So that's a great spot where level funding sits. And then through that, these are just an example of the centers that we have located across the country. We start typically with a virtual visit, and then we move that into a travel benefit. If a patient needs to travel to a center, the level funded plan does cover the travel for them and a companion to one of our centers that are located across the country. And then you see a few of the key recognizable names that are within the network today.
All right, Rich, appreciate the information. That was informative and really interesting. So hope you all learned a little bit more about level funding during that segment. And we're going to now launch the second poll question. Let me launch that. So what level funded health plan carriers have you been most successful with? Sounds like a good chunk of you have used level funding in the past. Edison may be new to you, but if not, would love to know if you've worked with Edison before. We've got a couple of the Buca carriers there, and then tell us if it's another carrier, if you've used somebody who's not listed here. And feel free to put that carrier or option in the chat if you want to share it. If you're really passionate about who you work with on the level funded side, we'd love to learn more about that. All right, we got a few more people coming in here. Give it 30 more seconds on that poll question. And if you do have other questions, just use the chat box and we're going to take questions at the end. Should have a few minutes at the end of this discussion to address any questions. So if you do have a question as we're going, put it in the chat and we'll address any questions at the end of this. All right, last chance on the poll. Going once, going twice. Gonna end that poll. And I'll share the results. It's also pretty close here. Seems like there is a chunk of you that have used a different carrier that we did not listed here. Some have used Edison, a lot at Cigna and United Healthcare. They seem to be two popular carriers. And again, if you're using somebody else, looks like Anthem is the one we left off the poll option here. A few people using the Anthem Balance Funding option. If you've got another one that you want to share, put that into the chat box. We would love to learn more about them. All right, well, I'll stop the poll there and we're going to move to our next segment, which is executive health insurance plans. So Brad, I'm going to turn it over to you to take us through this segment.
Thanks, Chris. I appreciate it. Well, hi again, everybody. I'll jump in and just say not surprising that only 9% of you guys have used or leveraged an executive health program in your practice. I think you'll likely connect with what it can do for you as far as the relationship with the leadership, the owners of a business. But I want to start just quickly with a little bit of history. Because to this day, and this is about 30 years for me in this little space in the market, we still get questions about where these things came from or what they are when we talk about supplemental accepted benefits. So just to really quickly and at a high level view, accepted benefits have been around since ERISA was enacted. So if we even go back to those days, which probably predates most of you that are in the room today, right? But ERISA was enacted obviously, it's at a real high level to just protect plan participants and so on. And even back in 1974, there was they started to define what types of insurance programs would be accepted and not subject to ERISA regs. So really, that was the birth of accepted supplemental plans. In 76, and I'm sure everyone here is somewhat familiar with Section 105, is an enhancement to ERISA, which basically defines non-discrimination rules, right? And what you could do, and I think a lot of what everybody's going to talk about today, whether it's self-funded, level funded, or now, as we know, even in the fully insured market, there are some rules that apply to the discrimination and discrimination testing for these programs that are covering employees. So in 76, thus the birth of a fully insured supplemental accepted benefit to be compliant with the 105 regs. And and again, forgive me, this is high level. I'm sure some of you that are very well versed in these things, there's a lot to these regs. This was just one of them. But 2003, I thought I would point out, was a pretty material time when they enacted this Medicare prescription drug program. This was, for many of you, if you connect it to anything, it's the creation of HSAs, right? But the other thing that it did that was pretty significant to this space of supplemental accepted benefits, considering that they're being done by, or for a select group of owners and key people within an organization, is that so many of these types of businesses in the small to mid-sized market are not corporations, they're partnerships, or they're S corps. So in 2003, the tax deductibility for the premiums of these types of programs, and as I'm sure you're all aware, your primary group insurance premiums became fully deducted for those owners that are not considered employees. This is a really significant tax law change, for what we did and for these supplemental plans, because it allowed owners that are not considered employees to get a full, deduction for the premium cost if they wanted to put it in this type of supplemental plan. 2010, as we know, ACA came into play. They, again, simply put, applied 105H testing to the fully insured market, but they also more clearly defined what the rules were behind, qualification for a fully insured, supplemental accepted benefit. So as we talk about what we do, we are very conscious of the compliance piece behind it. We're very conscious of what, in all these stages of what a policy needs to be and do, for us to come in or, and provide supplemental coverage on the health and wellness side for a select class of key people. Yeah, Chris. So types of things that are covered, which is a sort of a focus for us, and it will tie into, I'm sure, everything else you hear today. But this is just a spotlight on some of the things that, and the scope of coverages that are typically provided in a supplemental health and wellness plan. What we're pointing out here are the things that you might not be thinking of. So it's your vision and your LASIK, surgeries, and it's all your dental and orthodontia, including adult ortho. It's infertility treatments and psychiatric, and I'll show you later a little bit about where, what we see, and actually in volume of claims where we see these things. Hearing aids and batteries, physical therapy, private duty nursing, drug and alcohol rehab, prescription drugs, including out of formulary and over the counter, and so on and so on. So typically when a program is being put in the supplemental health space, it's a program that will cover all 213D eligible expenses. So what we mean by that is it's not just a plan that is filling your medical gaps, your out of network and so on, but it's also extending coverage to lots of other types of eligible medical expenses that people have. And it's purposeful. So when we look at, and here's just an example of the types of coverages and the level of benefit, and these are per person benefits. So if you had a family, each family member has these types of levels of coverage. Sorry about the formatting, not too sure what happened there at the end, but you can see that there's very robust coverages for each family member for pretty much every type of medical expense that you can think of. So let's think of this in a practical sense. If we're addressing even a small carve-out class of people, 5 family members, not an uncommon group for us, right? Business could be any size, but we're basically focused on that ownership leadership class. And it's actually in this case example we're showing you, but those 5 people and their families are all going to use the program very differently. So we're always casting a very wide net when it comes to the scope of coverages, because for one family, it could be balance bills for out-of-network services. For another one, it could be an in vitro expense. And for another one, it could be an expensive drug. Or it could be, I have 3 kids with braces, or it could be, I have a few clients right now, I'm getting 2 dental implants this year. So by casting this, wide net of what we can cover, we're pretty much ensuring that everybody's going to see value in the plan. And again, if you think about this from, again, your practice perspective, this is ensuring that the decision makers, the key people, those that are driving the business, of course, which is sort of our health and wellness piece of this, but also that are your clients, in essence, are well covered and well taken care of, and won't really be having any concerns or issues with their health plan because they're getting what they need out of it. So, and again, I'll give you an idea here, but we'll focus on just a couple things before you switch. Chris, is things like executive physicals, and we'll talk about that, right? What makes you like this is a big piece of what we do these days, which is the coverage for those centers of excellence, right? That Rich brought up. If they want to go and get an executive physical at Johns Hopkins, and who covers that? It's unlikely that's going to be covered under your primary medical plan. That would be something that we extend coverage to. So that would be 100% coverage, likely for that high level physical that you might choose to do at a center of excellence. And of course, the health and wellness, a little garbled there, but has been a growing space for us when it comes to how people are using our program in their pursuit of a healthier lifestyle with alternative and more holistic forms of medicine that are going to keep them healthier, that not that don't necessarily fall into more traditional categories of medical and pharmacy and so on. Thanks, Chris. Move. So I thought it would be helpful to show you guys a little bit about where we were before COVID and after COVID, and I know that I'm not really sure exactly what would medical plans see, because we keeping in mind that our scope of coverages might just go well beyond what medical plans are designed to do. But there was some takeaways that we saw. And so the pie chart that you're seeing on the left side of the screen is where our claim volume was on our book of business prior to COVID. And what you'd see is, just running around it quickly, about 35% of our claims were medical. Not surprising, right? This is everything from your deductibles, your co-pays, your co-insurance amounts, to anything and everything else that really just falls into that medical care territory. An in vitro procedure would be a medical claim, right? And so on. And prescription drugs, you're probably also not too surprised about, is also a big piece of where we paid claims, because we're now paying all the co-pays. We're also paying the differences in formularies, out of formulary drugs. So it's always hovered at that 20% range of our claim volume. Mental health was 6%. Executive physicals, even though we've always had this in our plan, it was only 3% of our volume. Wellness, about 3%. DME, 2%. Dental, you may be surprised that large percentage of what we see in dental claims, or maybe you're not. Dental can constitute a fair amount of our claims, and then vision and hearing. Post-COVID, what did we see? A significant increase in mental health claims, which I'm sure everybody's aware, far more likely to be out of network, et cetera. We saw a significant increase in executive physicals and a significant increase in wellness and lifestyle. So post-COVID, people are taking more responsibility for their health and their wellness. And that's, I think, I said when COVID was happening, I was like, people are going to be more focused on being healthy going into a pandemic, because that's really, where we saw the tragedy, was the people that weren't really healthy going in, right? So this is a takeaway. It's a trend that we're seeing. It's not going to slow down, but I thought that might be helpful when we think about all these things that people are doing today, and what is it that they're doing differently, and what can a supplemental program provide, as supportive for those needs. And then we're going to take you through a quick case example. This is sort of a very traditional group for us. It doesn't matter really how they're funded on the primary medical plan. So I'll just give you this high level. This is a current group that we've had. We've had them for years. This is a 2023 results. But we have this manufacturing group, 26 employees. They had two options. They had obviously a contribution strategy that applied to option one, and then a buy-up option to a much higher level PPO. And what we saw, what the broker identified, was that the only people buying up were the owners of the company. Everybody else was pretty much comfortable with that, with the base program they were offering and the contribution strategy they were offering, because there was a significant difference in the cost, right, between the two. So the solution that we brought to the table was to eliminate the buy-up option and provide a supplemental benefit for these folks instead. Now, why do you do that? You do it for a number of reasons, and it's not typically cost. It's going back to that scope of their needs and what what they really are looking for. Obviously, they were buying up because they wanted richer coverage, right? So now we said, but that doesn't address your dental needs and your vision needs and your mental health maybe needs, or whatever it might be. So what we have in the pie charts here is how the four family used it in that given year. And this is I thought this was sort of cool to look at because you can sort of see how different, even these are family members. So this is a group of, pretty much owners, but also, related people. They know how vastly different their claims were, not only in volume, but in the categories of where they use them. And then hopefully you can see that. But so we have this, people are using it differently. And honestly, if we bumped up this year in and year out, every year it would be different. It wouldn't be static. Those percentages and stuff would change. Those dollar amounts would change. People, unfortunately get sick. Something happens. They have more medical claims. Maybe they had that year where they had to do more dental work. So there's definitely, when we look at clients year to year, their usage by family or by employee, whatever you want to call it, is going to be very different. And that's really sort of a cool thing about these types of programs is they're adapting to that ebb and flow of where your claims are coming from and where your needs are. And then we'll take you through the financials and we'll wrap this up. So in a nutshell, on the back end of these programs, and unfortunately in this particular case, we have to be a little bit specific to our program because of the pricing models that we use. But this group, put the plan in, covered the 4 family members, and had approximately $30,000 in claims that were run through us. This again is everything that you saw in that pie chart. We then look at the tax advantages of that program. If you had compared that 30,000 to payroll, like what would I have had to generate at a company level to put 30,000 in our pockets to cover these expenses? And we use a 40% effective tax rate. You could argue it's going to be lower or higher, depends on where you are in the country, right? But it's just a round number. So we would just say, if you had to cover $30,000 of expenses for you have to probably generate about 50,000 at a company level before it goes through payroll tax and then personal income tax, right? To get to you to cover expenses. And their premium for this program was $36,650. So at the end of the day, they paid our company $36,650 in premium that was tax deductible to them as a business expense, right? 30,000 came back in the form of claims. There's no tax liability on those claims because they now are an insurance claim. And there's this estimated savings, whatever you would calculate their tax brackets to be, in this particular case of around $13,000 in corporate and personal tax savings by funding those expenses, through a program like ours. So hopefully that gave you a little bit of a feel. Again, not surprised about the 9%. I think when you think through, what is my relationship with a client? How do I build a good relationship with a client? Well, obviously, in some cases, addressing those needs and those concerns of what a client, if they make moves, is going to do disruption-wise could help you. So I think I'm on time, so we'll wrap it up there and field questions later. Thank you.
Yeah, thank you, Brad. Every time I hear this, it clicks a little bit more for me. It's definitely a unique strategy that helps those business owners, right? So if you're trying to sell and grow by solving the problems of those business owners, that type of strategy can really address some of the issues that they're facing and save them significant tax dollars. So appreciate your insights there. We're next going to transition to the medical expense reimbursement plan part of this discussion. Josh Pyzik is going to take it from here.
Thank you, Chris. And yeah, definitely a couple of very interesting and insightful presentations. And I think the first poll question showed that maybe this is the topic. It looks like this is the topic that has the least familiarity. So hopefully I can give you some valuable information on the medical expense reimbursement plan, which is really what we've specialized in at the Difference Card for about the last 20 years. So where does that fall within the funding spectrum for a particular group? We align this and illustrate this really as kind of a stepping stone into self-funding. So the medical expense reimbursement plan can align with the fully insured group or the level funded group. And it's almost like a little miniature self-funded plan that attaches itself to that plan design from your carrier, from your TPA, from your level funded carrier, and provides additional benefits back to the members based on the plan design that they're enrolled in. So things that come with the MERP that are similar to self-funding would be first and foremost cost savings. That's usually what's attracting clients to this type of solution. plan customization and flexibility. So you really, with the medical expense reimbursement plan, can define the individual benefit within a particular plan design that the member would experience. And then I think unique to our platform would be the security and the guarantee through a reinsurance or essentially stop loss policy and a partnership that we have with an A-rated carrier that really caps the liability of setting up a reimbursement plan. So again, it's maybe for that group that thinks they need to be self-funded, they're not quite ready to make that final leap. They want some of the advantages, and then maybe ultimately through being on the platform, they kind of get there to that self-funded model. So conceptually, how does it work? It's really in an effort to reduce the non-refundable cost of a plan. So premium, fully insured premium, or the bulk of the cost on a level funded plan. Our first step is we want to reduce that premium, and typically keeping your carrier, keeping your network, so you're not dealing with the major disruptions of finding new providers, but purchasing an alternate insurance plan from your carrier of choice and reducing that premium, taking that premium savings and investing it into the medical expense reimbursement plan, so that enrolling your employees into a higher deductible, higher copay, higher out-of-pocket maximum plan is mitigated by that medical expense reimbursement plan. And then ultimately what we find is that most clients are saving net somewhere between 10 and 20% by structuring their plan in this way. So that's really the first step is there an opportunity to go back to the carrier, reduce cost, eliminate the disruptions of finding new providers and new doctors, and reconfiguring the plan, adding a medical expense reimbursement plan to it. So this may sound like an HRA, and it's a form of an HRA, but there are some advantages of a medical expense reimbursement plan versus just kind of your standard cookie cutter HRA. We really highlight two of those, and most of our clients are utilizing maybe one base plan from their carrier and then building multiple options off of that through our funding mechanism. And we can do that. We can use that lowest cost plan from the carrier and still provide choice to the employee, both in the plan design, but then also the rate that they pay. So that's really the two advantages that we point out is you build multiple options, you can have multiple choice off of one plan. So it's maximizing the purchasing results from the carrier, buying that lowest cost plan, but then also taking a contribution from your employee. So through a medical expense reimbursement plan, it is allowable to split the total cost of the plan with employer and employee. And as most of you probably know, if it's a standard HRA, all of the costs associated with that type of reimbursement, admin and reimbursements, need to be 100% employer only funded. So our clients enjoy that the MERP is more of an appropriate cost share really for the full plan that is offered to that employee. And then it's also a COBRA eligible benefit. So through that premium equivalent rate that's issued, it just makes sure that as an active employee, you're taking an appropriate split. And then as a non-active COBRA participant, you're really collecting appropriate enough premium to still continue to fund the full plan that they have available to them. So I think next up is an additional poll question, which Chris, you're going to facilitate.
Yeah, let's launch our final poll for the day here, and we'll ask the question, which plan strategy designs are your clients using that fuel your growth? So when you think about plan design strategy, right, this can be on a level funded side, on a fully insured side. What plan design strategy are you utilizing the most? First dollar coverage, where you're like 100% coverage paid, that's the richest approach. Do you like copay designs where you're splitting copay costs with employees? Or do you really love that HSA approach, high deductible health plans, getting the triple tax advantage of an HSA? What's your go-to strategy? A few more seconds here to let everybody participate. Going once, going twice. All right, I'm going to end the poll. and share the results. Does seem like HSAs are very popular with this audience. Copays are a close second, and the first dollar coverage is a little bit rare right now. So interesting strategies, and HSAs are definitely a popular approach to save tax dollars and premium dollars for customers. So I'll stop the poll share there. I'll go back to you, Josh. You can show a
right.
case study.
Well, the good news about that poll is that the medical expense reimbursement plan can align with any of those strategies, an HSA, a PPO or an HMO copay plan, a first dollar coverage plan, which is really the solution or the case study and strategy that I'll highlight here and try to show you how the difference card would align with that strategy. So if you look over on the left-hand side, your current plan, I mean, that's a relatively rich plan with $1,000 deductible, probably a pretty low out-of-pocket maximum, and relatively low copays. And that plan's going to come with a premium. So the concept here, and kind of follow the arrows of buying down on that plan. And this is a pretty drastic move, moving from a rich copay plan to a deductible only plan that removes those copays. You now present to your doctor and your provider a $6,000 deductible before there's really any cost share with that carrier. But the premium savings are usually so great that we've got the ability, the client has the savings in the form of premium that they can use to fuel the difference card or a medical expense reimbursement plan for a really rich benefit. And in this case, just as an example, you present a $6,000 deductible to your provider, but you have a payment mechanism. So not secondary insurance, but a payment mechanism to buy down on the plan that you're actually enrolled in. And in this case, you have the first $5,000. So no copay, right? But you have a MasterCard, a debit card in your wallet that's funded by your employer, if you're the employee, that you would use to pay for medical and pharmacy services associated with that now deductible only plan. So this is a pretty popular strategy for medical expense reimbursement plans. There are dozens of ways to configure this, though. So you can buy down on copays. You can keep this with an HSA qualified plan. But this is our case study of a group that was looking at about a 20% increase, making no change with their carrier. So we want to then show the mechanics of let's buy down. What do we reduce your fixed cost to? And that's represented there at that 1.8 million. So you get just a huge reduction in premium and fixed cost. And then funding of those benefits on the difference card or a medical expense reimbursement plan can be incrementally set aside on a monthly basis, what we would refer to as a monthly budget option, similar to a level funded type plan, but just on the reimbursement side. So for this group, 1.9 million would be required to be funded into the plan over the course of 12 months, which would guarantee savings of almost $400,000. That 1.9 is protected through reinsurance. Talk a little bit more about that. But the 1.9 that's funded into the plan, if any of those dollars go unused, then there's 100% return from our MERP platform. So there is a guarantee built in here through the reinsurance. And then when the client runs better, as they typically do, there's usually money left over in the plan that they would get back 100%. We like to show a 5-year strategy. Most of our clients are long-term clients of the difference card, and it works year over year. We build out our exhibits and we show the effect of buying down on that plan design, keeping that strategy in place, or maybe altering it based on data. And we're usually showing a pretty high expectation for a 5-year savings. The way in which we can cap that exposure through the reimbursement plan, that $5,000 benefit that you give to everyone in the event that there's widespread usage, we enjoy a partnership with an A-rated carrier, Assurant. We've had this in place since about 2017, and there are hundreds of clients that utilize this to really protect that spend. So in the event that we spend more than what's defined by the reinsurance policy, well, the client's off the hook, and Assurant is really going to pick up any of those overages. Funding it can be very simple. So you pay your carrier, right? You're still fully insured, you're level funded. We would add just one more invoice into the mix, and it would all be fixed. So there would be an admin charge, obviously a reinsurance charge built into that, and then setting aside of claims on a monthly basis into a client-owned account that houses those dollars So really administratively, they fund our plan once per month, and it allows those cards and those reimbursements to take place as needed. It's really our no surprise model. So that group that's fully insured today, they're just used to paying a fixed invoice based on headcount. We can align our billing and our funding of the plan along with that carrier invoice. And then insight into how the plan's running. So the group's going to want to know how much we funded in, what they're paying out month over month into the MERP, and then what's being used. So overall data, but then individual data. So that can give you some really good insights into behaviors of the group and how they're actually using the plan, particularly for that small group where maybe you're not getting a ton of data. But in this example, we're showing that the client funded in, MERP dollars are paid out, they are running in surplus month over month. And so in the event at the end of the year, this group had $53,000 left over, that's what goes back to them 100%. So any of those dollars sitting there that go unused, complete return to the client. So what's a good fit for a MERP? Fully insured, level funded, the ability to, or the need to save premium dollars out of the plan. Usually a MERP is most appropriate for that 20 to 30 life group, and then we go all the way up. We do have smaller clients on the books, and if the numbers work, we can obviously, place the MERP, but it usually starts about a 20 life group. Fully insured, level funded, they want to improve benefits, they want savings out of the plan. Those would all be good indicators of is the client a good prospect for introducing a medical expense reimbursement plan. And then quoting is pretty easy for a medical expense reimbursement plan. Don't need a ton of information, really just the carrier plan designs, the rates that are paid, those alternate plans, and then who do you have enrolled? And we can usually turn around a quote within 2 to 3 business days. So that wraps it up for my portion. I think we've got a couple minutes here and probably a little bit of housekeeping to do. So thank you, everyone.
Yeah, thank you, Josh. Insightful information about the MERP strategy. So in order to get credit for the CE class here, we do have a QR code. If you could quickly take your phone out, scan the QR code. We'll also send this around later. There's a document here or a Google form where you just need to put in your information. We also see a lot of you put it into the chat, so we might be able to get it from there. But if you wouldn't mind, please just take your phone out, scan the QR code. This is the way you can get some credit for the CE class. And again, we'll send this around afterwards. Shauna will send it back through you, and if you wouldn't mind just distributing it to everyone. So if you didn't get a chance to do it during today's session, you can do it later on and still get credit. We'll also be monitoring everybody that responded to the 3 poll questions. Thank you for engaging in those. And then we've got a few minutes, maybe 2 minutes here for some final questions. And if you're interested in learning more, first off, we've got the information of Richard, Brad, and Josh here. Feel free to reach out to them for more information. Alex, thank you for putting that link into the chat. If you all want to just click that link, that's an easy way to get to the Google form, so you can put in your information. And I did see at least one question in the chat. This was from Victoria, asking about on MERPs, do you have suggestions on how to create it so S Corp, 2% owners or more might be able to take advantage of it? Or is that just not possible? So we do have situations where owners will join, but on a post-tax basis. So we have had some do that. But really the best approach that I've seen is to pair the executive health plan with the MERP and to put the owners onto the executive health plan, because that's the most tax efficient way for them. And then to put the non-owners onto the MERP strategy. Those two solutions pair really well together. And if the underlying plan is a level funded health plan with Edison, you can kind of put all 3 together in that type of an approach. But to address Victoria's question, I think that's the best way to do it. S Corp owners should really go to the executive plan. Chris is asking the question, are you able to send out the slide deck? Yes, absolutely. We'll send out the slides in a follow-up email. So Sean, I'm going to send this all to you. And if you wouldn't mind just sharing it with the rest of the group here.
Sounds good, Chris. Chris, thank you. And everyone at the Difference Card, thank you so much for making this CE possible. As a reminder, If you are not a NABIP member, now is a great opportunity to sign up for a membership, join your local chapter, and have one voice. We thank each and every one of you for being on. Hi, Chrissy Rankin. Nice seeing you on. Thank you so much. Your voice is always powerful in the industry, so I'd love to hear what you think. But thank each and every one of you. Thank you, Chris, Josh, and team, for telling us all about the difference card. Thank you guys for linking in that Google chat and typing in your license number. That is going to be the best way for you to get credit. And we will send the slide deck. Thank you guys so much for being on today and spending a little bit of time with NABIP. Have a great day.
Thank you all.
Thank you.
Thanks, everyone.
Thanks,
Bye.
everyone.